billions spent on research into new pharmaceuticals, often the best medicine is simply healthier food. And yet finding it can be a challenge for lower-income families that may live in so-called food deserts. It's one of the contributors to what's become a diabetes epidemic in our region and across the country. Now the Allegheny Health Network Healthy Food Center is partnering with the Greater Pittsburgh Community Food Bank to do something about it. Dr. Patricia Bononi is medical director of the AHN Center for Diabetes and Endocrine Health, and Colleen Ereditario manages the Healthy Food Center. And welcome. Good to have you both here.
Thanks for having us.
Yeah, before we get to the food center, let's talk about the health aspect of this, because this is really a big issue, not just here, but everywhere.
Yeah, diabetes is a big issue. 1 in 10 patients have diabetes in our area, and about a third of those people don't even know they have diabetes. So it's a tremendously expensive medical problem, and as you said, sometimes the answers are the simplest, is having healthy food available to patients to help manage their diabetes.
Well, and I've always heard about that, but you know, the simplistic thing is, well, you just eat fewer sweets and you're okay, but it's a lot deeper than that, right?
It's a lot deeper, because fresh fruits and vegetables are expensive and can be hard to access if you're in a food desert or an area where you don't have easy access to get healthy food.
And there's certainly communities here in our region where that's an everyday issue for people.
Absolutely.
And you really see that, just the difference when people can find a healthier diet, it makes a material difference in how much at risk they are.
Absolutely. We've been open about a year, and we've been following the A1C test, which is a measure of how well glucoses are controlled. And we've seen in patients that we've referred to the Healthy Food Center improvement in their weight, their blood pressure, and their A1C level.
So how does this Healthy Food Center work? I've heard it described almost like a pharmacy for food in some ways.
Yeah, exactly. So patients are referred from their primary care doctor or any doctor within Allegheny Health Network, and they're asked 2 questions related to food insecurity. And if they screen positive on either one of those questions, a doctor can write a referral to come to the Healthy Food Center.
Okay, it's almost like a prescription, but it's for food instead of medicine.
Just like a script for food,
okay.
exactly.
Yeah. And so what happened? Where is it? I mean, do they come to a physical location?
So we're located right beside West Penn Hospital at the School of Nursing. Okay. So once the patient has that referral, they can come to the Healthy Food Center and they'll get healthy, nutritious foods based on their medical needs. So whether they have diabetes, cardiac disease, high blood pressure. So the foods we give them will be based on their specific needs.
So they would come in and they would kind of be bagged up and ready to go. It's really tailored to their particular situation.
Yeah, so they'll shop with a registered dietitian and they'll also get nutrition counseling as well.
So where does the food come from? How does it?
So we get our food from the Greater Pittsburgh Community Food Bank.
Okay, and how long have you been working with them?
For the past year.
Okay.
So everything we stock is healthy as far as fresh fruits and vegetables. All of our canned goods are low sodium, all the fruits and natural juices. We have whole grains and low-fat dairy products and lean meats.
And so people come to the center. So is it primarily serving the east end of the city, or do you find people coming?
We get referrals from all over the Allegheny Health Network footprint. So we've seen referrals probably from 20 different practices within AHN.
Wow, that's really exciting. And you say it is, you've noticed, you've been at it for a year now. So are people using it, and what benefit does it seem to be providing?
Yeah, the patients love it, and I think really the added benefit is they get to shop with the dietitian. So they talk to them about portions and what foods to choose and why they're choosing them. So it's an educational process as well.
Well, some of this is. Some of it is availability. Can you even get the healthy foods? But some of it is knowing what foods you need to eat.
Exactly. And I've noticed too, providing the patients with the healthy foods and the education and support, it's really empowering for them to want to improve their health. So they've just never had a resource like this before.
And there's really been nothing like it here in our region before. Has this been done in other places? Is this
I believe Geisinger has a similar setup, but this is the first in this region.
Yeah, in eastern Pennsylvania,
yes.
Their medical center near Danville. So they've been doing it, but now the AHN has been operating it.
Yes.
Yeah, so where do you go from here? I mean,
So the plan is to replicate this Healthy Food Center model throughout each hospital system throughout Allegheny Health Network.
Okay. Any kind of sense of timing about how that's going to roll out?
Probably within the next year.
Okay, really?
Yep.
So you're going to move on pretty aggressively. Well, it's exciting stuff. Congratulations to everybody at AHN. And so you're the expert on diabetes and endocrine health. What should everybody listening, whether or not they live in a food desert, keep in mind to make sure they never have to come see you?
Yeah, you know, exercise exercise regularly, try to keep your weight at a healthy level, and see your doctor regularly to get screened.
Screening, because I guess it's like a silent disease for many, many people, right?
Absolutely. About a third of people don't know they have it.
Wow. An important word of the wise from Dr. Patricia Bononi of AHN and Colleen Ereditario, the manager of the Healthy Food Center. Congratulations again. Good to see you both.
Thanks so much.
Appreciate it.
And we'll be back in a minute with a little dollars and cents. Please stay with us.